Sean Cunningham. Can I ask a question about growth? We're a growing area. What is the CCG plans to meet that growth in terms of providing healthcare in communities? In the sense that we are having, say, 1,000 houses coming along now. Communities are under pressure. Every planning application that goes in, people are, one of the core issues that comes up is GPs are under pressure, waiting times for those GPs. So can I ask, in terms of the CCG plan, CCG, what plans I have to meet that growth? And can I ask a second question, some clarification on Welborne, can I ask? It's not, we've seen your joint press release with FBC. I think that many people welcome that. Do you have clarification as well? GPs will actually be servicing Welborne in that hub?
Yeah, let me pick that question up. So probably 5 or 10 years ago, we would have said, well, we'll take the number of people and then we'll increase the number of practices and increase the number of GPs, and that's how it worked. Populations grew, we got more staff, and that's how it worked. But we're at the stage where we haven't got the money to just keep having more and more GPs, and even if we had the money, there aren't any GPs to get. So we have reached, I don't want to say we've reached a crisis because I think that's over-dramatising it. We have reached a stage where it isn't working, and so the real answer to that question is we are going to fundamentally, in an evolutionary way, but we are going to change the way the health service works. So we know that, as I said before, there are a lot of people who are going to their GP and they're actually not getting long enough because they've got a complex condition and lots of medicines that need managing. We know some people go to the GP, but actually they don't really need a GP, but they definitely need something, they need support. So in the future, as we've said, practices will come together and be working in these kind of natural communities. We'll be looking at lots of different roles. So actually, you end up getting to see a GP when you really need to see one, when you've got an urgent problem. But for some of the things, you might see somebody very different. And what it will mean is we'll be able to do it because we'll be using lots of different groups of staff. And also it will be more affordable. But actually, most importantly, people will get much closer to what they need than they are doing at the moment. So this is really the whole model of care. And actually, it's just an example in the north of the patch. I just happened to be in one of these hubs that is actually up and running. And it's just a lovely story. There's a paramedic now who works as part of the team, and that wouldn't have happened a few years ago. So we have got paramedics. Paramedic comes and he does a lot of the home visits, and he was just telling me about a story last Friday where he'd seen a really frail elderly woman who got a chest infection, and he went out, they knew she needed some antibiotics, and they just couldn't work out how to get the antibiotics to this lady because the pharmacy had just closed. And all that kind of stuff, and they just got it sorted, and it was just so quick and easy. And if that guy hadn't done that, probably that lady had been admitted to hospital, and then she might have been in hospital for a long time, and then she wouldn't have been able to cope at home afterwards. And just by having different models. So the answer there isn't to have more GPs who could go out on Friday afternoon. It's actually to think more creatively. So that's really the future, looking at different people providing the needs that our populations have got. So if we come to Welborne, and we are absolutely committed to working in real partnership with the council. That's fundamental for us, that we work together to plan this forward. But I know some people wanted us to say, and we'll build a new surgery and we'll have 8 or 10 GPs, and honestly we will. But it would be really wrong of us to say we'll do that, because we know that isn't the model of the future. It won't work in the future, particularly by the time Welborne's built. And we haven't got GPs who want to work in that sort of model. People want to work in a different kind of model now. So our absolute commitment is there will be some health and well-being space in that development. And there may indeed be some GPs who are there some of the time, but there'll be lots of other things which I think will give that population, as it grows and evolves, far more of what they really need. The problem we have is kind of, if people start taking that as we won't be providing GPs, it all sounds very negative. So the battle we've got is to try and help people to realise that the way we want to change health services is genuinely a positive thing, not our cuts. And I always say, while we've still got Casualty and Holby City and all these programmes on television, the day we get the integrated care hub or whatever we're going to call it, we'll be motoring then. So we want people in communities, through experience, to have confidence that these new models that are beginning to pop up but aren't yet everywhere, have confidence that people will start to get much closer to what they need.
I think it's fair to say that I think you mentioned the word hub. Most of the public wouldn't understand what you're talking about, and I think, as you say, it's about conveying a positive message of what it's there and what it's going to achieve. About the growth of the area, how are you going to meet that demand that's coming forward all the time? The pressures on the GPs and that.
Well, I guess it's the same answer.
Same thing.
It's the same thing. So I think if we keep asking our existing GP workforce just to do more and more and see people in 3 minutes, not 5 minutes, it just actually won't work.
Right.
So the approach is that we have to do this very differently. We have to bring groups of GPs together to work differently. We have to split out people who need very quick, same-day, urgent access from people who need longer, who've got more complex plans. And and there are a lot of people who need access to psychological therapies, to mental health provision. There are people who need more like a coach to help them with aspects of their life. So there are a whole range of things we need to do, and actually, most of those are not about just perpetuating the old model. So we've got to do this, and I guess we really want and value your individual and your collective help, because bringing together all the people who've got enthusiasm and energy, so like the Parkinson's group we were talking about, that's how we'll start to do it. If we, and that actually comes back to Welborne, just taking natural communities and using the natural resource and the people who are available and helping them and bringing it all together will definitely get a better result than everybody working in silos, just actually somehow hoping that we'll have more money.
So would it be fair to say then that when you talk about the hub at Welborne, you're actually going to see that model in most of the GPs in the area, though? Would it be fair to say that? So
going back to this at scale, it will really only work and help Portsmouth hospitals, if you like, in the middle of it, if we do it everywhere. If we only do it in pockets, it'll be okay, but the hospital will still be at the centre. So actually what we have to do is get these hubs, and you're right, we do need to think what we call them much better, but we have to get those across the patch, pretty much offering the same kind of service over the same time period. We can have a bit of local variation, but if there's too much variation, then no one quite knows what they're getting. So that's a big ask for us locally, across the NHS, that we start to get a little bit more uniformity, because actually you're right, people know what their GP is and they know what an A&E is. And those are the things that people know and trust, and see it on television, and we've got to try and not reinforce that model and try and help people to see that the model that we're putting in place is different, but it will actually give them more of what they want.
Can I just stay on that point a minute? When you're talking about a hub, but I'm in inverted commas, it can't be multidiscipline. So are you going to use it as a signposting situation to people to go to the hub, and then you'll signpost them where they want to go? Is that how you envisage it?
Shall I give you an example? So we're in the Willow Group, which is 4 practices come together, which is 40,000 patients now. This is where you're starting to work at scale. We can employ nurses, and we've got paediatric nurses, we've got advanced nurse practitioners, we've got nurse practitioners, and we've got physiotherapy. So people phoning up on the day that they think that they want to come and see me, will get put onto a list, and we'll all sit in a room triaging patients, talking about patients, and getting them into a place where they perhaps need to be, whether they need to be in hospital, whether they need to stay at home, whether they need a prescription, and that's all done at scale, and that's where you're talking about locally, how scale will work. Now, some of these hubs in Gosport at the moment is a sit in the Gosport War Memorial, but they don't actually have to be in one place. You could have a group of practices together, which will be a virtual hub. So that's the sort of thing, and that's where, how as a locality, you'll develop that, because that's what, between the patients and the clinicians, that's what you'll feel that you will want.
So how would you provide acute services in a hub like that?
Sorry?
How would you provide acute services in a hub like that?
So acute services, so
Acute.
do you mean acute as in mean going, well, take it in the instance of one example which happened to me on Friday, which was someone who'd become very septic, and again was out in the community and had one of the nurses, and I was hearing them talking, and I was saying, hang about, that person seems to be as though they're septic, right? We need to, they can actually get into the hub so they can be quickly assessed, and actually they need to go into hospital straight away. So as the nurses were seeing them, I was on the phone to QA to get them into hospital, to get their antibiotics within an hour, and the ambulance had been. So that's something where acute services have been. If you look at some of the children with chest infections and wheezes, which have a lot, they come and see a paediatric nurse a lot of the time. We've got this coast system that they have with paediatric nurses, where you get children who are either hot, or they've got breathing difficulties, or they've got a gastroenteritis, where they can be looked at, revisited back at the hub, and also is that they can be visited at a hub. So those are the acute services which are greater at the moment than perhaps the out of hours that you have at the moment to do, to actually support people at home, and that's where you're providing acute services to keep them at home safely.
And I think again, for a facility like Welborne, which is currently a whole series of fields, so it has no physical buildings at the moment there. Actually, if we go down the traditional planning route of a GP surgery there, a community centre there, this, that, and the other there, actually, if we be a little bit more creative and bring those things together, then actually that is a community health and wellbeing hub, and it may have some access to some GP input into things there, other therapists and things there. I mean, on a different scale, and looking at my own personal perspective in Whiteley, we're slightly ahead of the curve, as in they're going to start the building sooner than they will do in Welborne. But of course, we know that there are going to be X thousand more patients there, and for my practice, Mariam's practice as well now, we're the logical place for that there. So we have had conversations. So in anticipating that there are going to be X thousand more patients there, then of course then we can now start to plan and say, so actually as a result of that there, we need to use our space in our current sort of surgery differently. We will need to recruit new doctors. Thankfully we've been lucky to be able to recruit Mariam to come and join us there, and we would hope to be able to do the same thing again in the future when more people are coming along there. So on a small scale, actually an individual practice may have the capacity to take on new builds, but obviously and a development on the Welborne scale there, as I say, it's unlikely that a practice just going to say, send them down. We can deal with that there. The advantage, obviously, of new patients is obviously they do come with funding. So everything is paid per head of population. So of course, as the population increases, then actually the level of funding available to us does increase. But what we need to do is to ensure that we deploy that money as effectively as possible. And I think, for reasons of history, as in, actually to sort of just do more of the same there and plonk a GP surgery in there, we actually know that that's unlikely to be the answer for Welborne. But actually look at it more creatively, around a community sort of facility there, because actually, it's not all going to be about putting as many houses in there and as many people as possible there. The development will have to have some additional facilities there, and rather than it being a separate surgery, community centre or whatever there, let's actually, start to have those conversations and do things together.
I think-
Because our approach to things there has to be more integrated.
I think the key, for me, listening to you, sounds quite exciting actually, is to actually how you take the public with you and how they understand what you're trying
Yes,
to do. Because
yeah.
I think there's a mismatch at the moment, and I think what you said, most people see GP surgery, or what you were talking about is something far more modern, more exciting perhaps, and it's how you take that public with you down that line.
In this very room, not long ago, they had the launch for Welborne, and I collared Mark Thistlethwaite, who's the boss of the development company, and I said, are you going to build a medical facility of some sort? And he said, well, who's going to pay for it? I said, well, you are, because you're the developer, it's only bricks and mortar. And then I said, it would probably be used by Skype. You could have someone there, because of the infrastructure problems which you know about, coming here, don't you? It'll be just as bad trying to get to Welborne or Welborne Community Hospital. So if Skype is a way forward, and for a long time, closed circuit television, if you like, has been around, that could be used to actually talk to patients. So they come here, maybe, or in the GP practice, and talk to someone or if they're in Welborne, they go to a medical centre and talk to a doctor who might be in Gosport or wherever. And he's got their records, the same sort of thing you're talking about, but the Welborne Community Hospital is difficult to get to. So what will Welborne be like when it's built?
But what you're saying presupposes that everybody is tech savvy, and they're not.
No, you would have the facility in one place so they can talk to a doctor somewhere else.
I know, but it still means that people got to be tech savvy to go there and use it.
Oh yeah, well,
But
not
you may
tech
have
savvy, they
someone
just sit in
in
front.
the centre who's a sort of can help you with that and sit there with you. And sort of
You don't need your own Skype, you use...
No, I'm aware of what you're saying, but
in Cornwall, because it's a kind of a quite rural
Yeah.
community and therefore it's difficult to travel, and so they do use Skype consultations quite frequently in Cornwall, and it's something that's been quite successful. But I agree, you need someone to help you with it if you're not a whiz kid on technology.
I think we've got to go on this journey together, because actually for some of these innovations they're quite scary to us as healthcare professionals. So actually, of course, they might be quite scary for you, as the public using them there. But actually, if it becomes a mechanism to deliver care differently and in a more efficient and sustainable way there, then I think we've got to embrace the opportunities there. And where you're starting from scratch and you've got a load of fields there, then that's the ideal opportunity to design and develop it in a way that is going to meet the needs of that community going forwards, and to build a 21st century sort of facility, but sort of plonk in some 20th century medical facility there probably isn't the right thing to do.
I went to an American company about 15 years ago, and I went into the boardroom, I waited for some people to come in for a meeting. There was a screen that size, and I thought, the noise coming from that, and it was a cleaner. And I said, so, excuse me, where are you? She said, oh, I'm in Ottawa. I said, well, what time is it there? She said, well, they've all gone home, I'm cleaning up. And that was a very live link. It wasn't Skype, it was a permanent link. And that's the sort of thing I think that Welborne would have to somewhere here where people could perhaps come to somewhere in Fareham or and talk to a doctor.
Yeah, and I
Not
had a
Skype.
fabulous example of an Age UK programme where they'd given people, older people who were housebound, tablets and taught them how to use them, and then set up a sort of network so they could talk to other people who all had their tablets. And the original idea was that at 10 o'clock on Monday morning you plug in and you talk to Mavis and you had a conversation. And actually what happened was the people that were using the piece of kit kept them on all the time and just spoke to their friends, became friends with all of them and spoke to them all the time.
turned it into a social network.
Yeah.
God.